Well, it's not a new trend, but it's certainly continuing to gain more popularity as time goes by, according to cosmetic surgeons.
23 ABC's Tori Cooper spoke to a plastic surgeon who specializes in butt augmentations, as well as a patient, to help better understand why the demand is so high and how you can ensure that you're in the right hands if you're considering this procedure.
For decades, many cosmetic procedures marketed towards women focused on thinning the waist or augmenting the chest, but now the backside has moved to the forefront, according to plastic surgeon Dr. Firoozenpour of the Beverly Hills Cosmetic Surgical Group. So tonight I am showing you more about the popular procedure and what you need to watch out for before you decide to go under the knife.
I mean, I was confident before, but just I felt better, I looked better, it just did everything.
34-year-old Selena Moreno is one of thousands of women who felt a need for a change.
I think it was the trend, and then seeing other people do it, and just I was like, you know what, I wouldn't mind doing this for myself.
Working for Dr. Fardad Firoozenpour's Beverly Hills Cosmetic Surgery Group as a receptionist, Moreno says she has seen an average of 3 women a week in the last year come in for a Brazilian butt lift, a fat transfer procedure which she says also contributed to her decision to try the procedure herself.
They took my fat from my upper and lower abdomen, my waist, my love handles, and my upper back.
Dr. Firoozenpour, director of the Beverly Hills Cosmetic Surgical Group, says over the past 19 years of his practice, the demand for the Brazilian butt lift has increased dramatically, but not just among women.
Usually females are the most visited to our office, but there's a trend among men as well that they want to have a little bit shapelier buttocks, so they look like they've done workouts or they do some squats and all that, so they have a better contour.
Dr. Firoozenpour says the procedure doesn't take more than 3 hours, depending on how much fat he has to remove from the body.
What we do is, under sterile condition, we harvest, so to speak, the fat by removing it from the body. We concentrate it and transfer those fat cells that we took out into sterile syringes and then inject it into the area that we kind of pre-marked and agreed with our clients where they wanted or what part of the buttocks they want enhanced.
In many cases like Moreno, Dr. Firoozenpour will do his best to inject in areas near the butt crack, the crease of the butt, or in areas that already have discoloration to disguise entry points.
I have a scar in my belly button, here on my sides, and on my butt where he did the injections.
This is Moreno before, and this is Moreno after.
So I'm more secure about myself. I wear clothes that I probably didn't wear before. I actually wear swimsuits now, 2-piece. Even high waist is still my favorite, but I do feel more comfortable in a swimsuit now, yeah.
Dr. Firoozenpour only recommends the procedure to clients who are at a healthy weight, because if you are overweight and working to lose weight, there could be complicated results.
The reason is that if you take the fat from one body part and transfer it to the gluteal or the buttocks that we're looking for, and then they go on a diet afterwards and lose more weight, the fat that was transferred will shrink as well.
Dr. Firoozenpour says more women are also choosing the fat transfer Brazilian butt lift method because of the difference in healing time, costs, risks, and scarring as compared to the butt implants that look like this.
It requires a little bit more of an invasive procedures where we have to make an incision large enough for us to place an implant inside the gluteal or buttock muscle. The recovery is a little longer, a little bit more pain involved afterwards, more restrictions afterwards.
The Brazilian butt lift originated in Brazil, but in the U.S. it ranges from $3,000 to $6,000 and implants range from $7,000 to $8,000. After both procedures, Dr. Firoozenpour recommends no physical activity, no sitting, no long-distance driving, and no sleeping on your back for 2 to 3 weeks to ensure the fat cells heal and survive and that you are not at risk for infection. Patients are also prescribed antibiotics, Tylenol with codeine, and you must wear a corset garment to help your body heal. But you do have to live a healthy lifestyle to ensure lasting results.
A lot of people have the misconception that you do the lipo and that's it. You really have to work out. You definitely have to eat right. If not, you're going to gain the weight right back.
Moreno says she was 155 pounds before the surgery and that she weighs 145 pounds now. She hikes and dances regularly and cut out chips and soda. Dr. Firoozenpour says depending on your diet, exercise, and age, you may have to come back in 2 to 3 years to keep your new butt shape. He hasn't seen patients over 60, but he has seen patients as young as 19, as the trend has picked up because of the major influencers in the entertainment sector.
Beyonce, we're getting a big demand for the shapelier, rounder looking buttocks. I think J.Lo had the first trendsetter. Kardashians kind of brought it on, added on more to the demand.
Dr. Firoozenpour also says it's important to check with the California Medical Board website to look up any doctor you may be considering.
Put in the last name, and they should have their training experiences and any, God forbid, malpractices that they may have against them listed on the medical board. So you have an idea, safe physician, non-safe physician, are they licensed? Is the license active? Were they been under suspension? Were they under probation or whatnot?
As for Moreno, she says based off her experience so far, she only has one message for people who are considering it at home.
It's easy. Recovery is not bad. Pain is not that bad. But then again, everybody does respond differently to pain.
Now, Dr. Firoozenpour says it's important to also remember that as you age, your skin and or your butt may also start to sag, and correctional surgery costs just as much as the original price that you paid for the Brazilian butt lift. Financing is not available, but there are some outside credit companies that are accepted for the Brazilian butt lift, according to Dr. Firoozenpour. But for now in studio, I'm Tori Cooper for 23 ABC News, connecting you.